I am going to be officially welcoming you guys to the first February general meeting. So today we have a big agenda, but it's almost like planning out for the whole year and what we need to do for the QHSC. So I welcome everybody here. Somebody's coming in. I welcome everybody to the meetings, and thank you for joining us and spend Saturday morning with us. So let's look and send it. Agenda today is February 11th, 2023. As I said, it's the first general meeting for this year. We do welcome prayers for the meeting. I was hoping Mr. Steve Jones, our prayer warrior, will be here, but if he's not in the beginning, then he might show up later. And then introduction to members, so we can just go over the list of who are the executive team, leadership team, and members who are attending the meeting. And then also we have recruitment, members recruitment, and all the information that we're going to share and expect people to join in. They're going to be using that info, Dr. Gaboni Qhsc email. So that's going to be the new email for the organization to send all the information. And then, so this email is going to be monitored by executive team. So whether if somebody has any issues, concern, questions, so then one of executive team, there are 4 of us. So one of us can just respond as soon as we can. So then we can expedite things. So all the feedback, concern, if we have any meetings and stuff, that's the email from now on. We're going to be using that. For the member recruitment, we're going to discuss about the criteria, requirements, benefits, and contribution. And then we're going to have, sorry, that was supposed to be uppercase, yes. So U.S. community outreach, Janet Musa has been working on that area. And then if she's here when we're getting to that position, then she will give us an update. If not, then I will share what she shared on the leadership meeting. And then the next one is the fundraising and contribution opportunities. We have our own very Miss Bree, and she's going to share what exciting news she has for us. Next, we're going to talk about the Global Volunteer Code of Conduct. Dr. Gwen helped us draft that list of expectations. And then, so at that time, I know she's at the conference now, but I will share what the executive team has gone through that document also and agree with those recommendations. I'm going to share the dates for the medical mission, what plan we have for this medical mission, and what other things we need to do. We can discuss and share with that. With that, I'm going to let you guys, oh, sorry. I need to give you the list here. So I'm going to tell you guys say hello, and then we're going to go on the list of the executive members and stuff. Miss Valentine, you're on my left.
Good morning, good evening. No, good morning, good afternoon, right? In Tanzania, yes. It's afternoon. Mm-hmm. Good morning, good afternoon. My name is Valentine Dantes, and I am QHSC's Executive Secretary.
Thank you, Miss Valentine. Bree, you're next.
Good morning. My name is Bree, and I am a QHSC Global Volunteer. Excited.
Yay. Mr. Brown.
Good morning. Habari za asubuhi. Good afternoon. Habari za mchana. My name is Parank Qhsc Akabe, and I am the Executive Vice President for Dr. Gaboni Qhsc, located in the United States and Dar es Salaam, Tanzania.
Karibu. Yes.
Hi, good morning. Hi, good morning. My name is Jessie Vargas, and I went last September to Tanzania.
Thank you very much. Miss Catherine.
Hello, everyone. My name is Catherine, and I am the Executive Treasurer for QHSC.
Thank you very much. And as you can see, the executive team is already here to serve the community and global outreach. My name is Dr. Haiti Gaboni, and I'm CEO, President, Founder of QHSC. long-term global volunteer, and I enjoy what I do every day. And I'm being supported and blessed with executive team that works so hard to try and get the mission out, which is serving the communities. So I'm gonna go back to my little document and give you the just the team, so you can have a complete team who is what. Okay, so you guys know myself. Mr. Qhsc is the Vice President, Ms. Valentine, Executive Secretary, Ms. Catherine Dudex, Executive Treasurer. Dr. Gwen Randall is the one of the Board of Directors, specific area for anesthesia specialist. Dr. Lilian Sambichaka is Board of Director, Medical Clinical Specialist. She's everything health. Mrs. Victoria Jones, Board of Director. She's a burn specialist and she's been to Tanzania twice. Mrs. Janet Musa, new member of Board of Directors, and she's a community liaison. Ms. Anne Schneider, she has been the founder, part of the founding members of the Qhsc, and then she stepped out for a little bit, and now she's coming back to be one of the Board of Directors. And her areas of interest is grant and fundraising section. Mrs. Irene Gabone, she was advisor from the beginning of this Qhsc. Mr. Gilbert Gabone, George Gabone, they both have been founding Board of Directors when we started, and then now they're at the capacity of advisor of the Qhsc. Ms. Bree Vargas also is special unit business fundraising liaison. So anything that I ask her to do, she's always jump in there and help. So thank you, Ms. Bree. Okay, so for the discussion part, we already discussed introduced members and their goals. So now the recruitment part. So Ms. Valentine, you want to say something, and then we can start sharing that document. Mr. Prank, is it ready?
Just that, we did, just to repeat that we'll be starting at March 1st. So in the next few weeks.
Okay, so for a new member, for example, when they come in, I mean, I know you're still working with the document, just give us a little synapse, like what is the process is gonna be? Like what?
Okay, so there will be questions. So basically I'll be interviewing all the new members and asking you questions such as like, like what brought you to Qhsc.
Yeah, that's okay.
So like I said, I'll be interviewing the new members, and then you will also have to sign a document, which is basically going to be an agreement between you, the new member, and the organization. And then, yeah.
Cool. And as I said, we're still working on a lot of stuff, but definitely for March 1st, as she said, we're going to start having that conversation. And wherever you finish filling out those information that she's going to be talking to you with, then you're going to be sending to that info, Dr. Gabone Qhsc, and we can start compiling and make sure we have a good library of everybody who is working with Qhsc. Mr. Branco?
Yes, I wanted to add to that so many things. But no, thank you for your efforts, Valentine. And okay, here we go.
Yeah, that I can't speak. Okay, that's okay. Thank you for coming. Go ahead.
All right, here we go. Everybody see my screen?
Yes, sir.
Yes.
Yes.
Okay, so I'm just going to go over the what we have in this document. And remember, as leaders or team members, everything here is subject to your input. So looking at Dr. Gabone's membership development, because it's about getting people in, cultivating the members, and then keeping them, and getting them to do something that they really enjoy and that they really love. And so that's something that I'm learning about. Service is something I think that's innate to some people. So we're going to attract certain people because this is what they like to do. So we're giving them the opportunity to live out their dreams or their passions. So how do we keep them, and how do we maximize them? and get the most out of them for the people that we're trying to serve. So this is what we basically have in our membership agreement. So in the end, you'll see that it is a formal agreement. So we're looking ahead to the future, and the benefits for QHSC membership. If anybody has anything else that they want to include, just let me know. So we're able to give certificates, which we've done, and letters of recognition and professional recommendation. Like I just basically updated my LinkedIn account, and I know I've been telling Dr. Gaboni that, oh, I got to put in my QHSC experience, you know, on my resume or on LinkedIn and different places like that. And I think it's been like almost 3 years and I still haven't done it. So finally this week I put it in there, and I've used it in interviews before and I've gotten a lot of interest from it, but so I finally did it formally now. You know, members will be recognized through social media postings, so social media recognition. QHFC, same thing, QHSC website professional recognition. So we have like top mission performers, people who go there do really good, like these interview videos, things like that. They'll be recognized on the website as well as on social media. We also will give, and we have done this before, letters of community service completion for professional development. Like, you know, some organizations, including the military itself, require their members, if they want to get promoted, they have to do a certain amount of hours of community service, and they usually have to have a 501c3 letter to verify or confirm that. A lot of the private schools, and I think even the public schools, do that as well here in Virginia. I don't know about the other states, but yeah, they'll ask the student to come in. It's part of their, I guess they need it for some kind of completion for the semester. They have to have a letter showing that they did a certain amount of hours of community service. So we'll offer that. And it also gives, after looking at a lot of social media and things like that, and the things that go on within these organizations, it gives people a trusted 501c3 organization for tax deductible donations. So you know you're giving your money to someone, and you know that that money is being used effectively, and it allows for professional development, or should I say membership allows for professional development. It also gives those who really want to the opportunity to serve those in need and the underprivileged. It's a free initial membership. Will come with a QHSC souvenir. So that's just once they join for the first year, they'll get either a t-shirt, a mug, or hat, or something like that. We'll determine what we'll give out for that year. And depending on funding, financial cost mitigation for mission members active over the last 5 years. So if we are able to come across some form of funding, we're able to help people cover the cost of their mission, and it will go to the active members. I don't know, leadership and teamwork skills development, which is really good. That's what we're doing right now. Access to QHSC records and documents when a valid organizational reason exists. So somebody can't just come in and say, oh, I heard that, you know, let's say the Etsy or whatever website it is that you're doing this and you're doing that. I want to see the, you know, the calculations or the taxes for the year. Well, you're not a member, you can't see them. If you are a member, then yeah, you can request to see it. If you say, oh, well, I want to see them because I don't like Bree, then you can't see it. And that leads us to the next one. That means it's access to QHSC records and document when there is a valid organizational reason. So it has to be something of interest to the organization. You just can't say, I want to see this because you don't trust somebody, or you don't feel confident in that person. If that's the case, then we can just let Dr. Gaboni or Catherine or Valentine know, and they can go back and they can review the documents themselves and make their own determination. But it doesn't mean that we have to show it to everybody. Opportunity to conduct training, which you have done, and attend free QHSC training and webinar sessions. So those are other benefits as well. There's quite a few opportunities to submit, manage, and develop local and global community service projects. An example, Dr. Vanessa came on board with us last year. She's an optometrist, and she basically just designed, ran, implemented, you know, with feedback and help and everything, just did everything all on her own. And then when they got to Tanzania, it was her and her team there, and they basically just did everything, which is, it's an excellent professional opportunity for people who are servicing, you know, communities. It's a great opportunity to be a global community service, to be a part of a global service, community service family. Sorry, I got to slow down. And you get to learn the Qhsc language. And remember, Qhsc does mean the Qhsc language, but I wrote it that way because it's in English. Make a difference in the lives of people from all walks and levels of life. So we can impact people. And then, so like, especially with the executive members, we are authorizing, or we'll authorize them and other active members to have a Blink business card. I know you'll have access to exclusive social media and digital content. So as members are representatives of the organization, they're required to participate in certain annual events, volunteer for at least one community service activity per year, to include the medical mission, be present for 75% of the voting meetings. And that's going to be for especially board members or meetings where there's going to be votes being cast, and be present for 50% of the general meeting. So if you're a general member or a regular member, then we expect 50% participation in those meetings. Another condition is identify the number of QHSC volunteer hours per year. So kind of like try to keep track of the number of hours or events that you participate in, the time frames that they cover. So you'll be able to kind of let us know what your hours are. Participate in stateside Qhsc community service project once a year. We're going to start doing more stateside community service projects. Another condition is to contribute to the development of or participate in an international Qhsc medical mission service project once every 2 years. So an example of that would be like Nancy Littner, who does a lot of fundraising, or she participates, actually she participated in the medical mission, not the last one, but the one before that. She actually did training online via Zoom for people at the Dodoma Medical Center. So she finds ways of contributing, even though she doesn't go to the medical mission. So as long as you can contribute, or if you want to go on the medical mission, either of those are valid ways of doing it. And then also another condition of membership will be to pay the annual contributing amount designated by the board. So right now we have those amounts, and I'll go over them. Thing to mention too, any Florida state rules. So Florida has rules that govern members of its non-for-profit. So if there's any rules or anything you're not sure, just, you could always say, well, what does Florida require for me as a member, or even for the non-for-profit in the state of Florida? And then also, members shall not represent Dr. Gaboni Qhsc in a bad light. So we want people to keep it positive and always try to keep us in a good light. So those are the conditions of membership. And the types of membership, we have paying members and non-paying members. So the paying members are the board members, Qhsc advisors, executive members, Qhsc members, and student members. Non-paying members are the Qhsc friends or non-members. They don't have the right to elect directors or have any say on fundamental matters, and will not be privileged to auditing of Qhsc documents, financial records, or leadership proceedings. Corrective actions: if there's an issue or a problem that occurs with a member, we'll have, we can, by the bylaws, we can form a standard and ethics committee if there's not one that exists already. And board members will analyze the information given and provide insight on corrective course of action for a member. Number of corrective actions to be given out is, I'd say the maximum is 3. And these, they can be notified by email as well. Executive or board member can issue the corrective action or handle it by email. Example, paying dues. So if someone's behind on dues, the finance team will reach out to them and then they can take corrective action. Now, if they don't pay the dues, that leads to the next one. And if corrective action is not taken, it can lead to either resignation, termination, or suspension. And these can be applied if the corrective actions are not followed. And this is, we want to continue to develop quality membership. We want to make life better for all of us, because the better the quality of our members, the easier our lives will become, especially when we go on medical missions and stuff like that. And these are the established dues that we have right now. And this is what the team voted on. So the board members, QHSC advisors is $150. Executive members, $150. QHSC members, $75. Student members, $50. And QHSC friends, they don't pay anything. So that's going to be $0. And then it's a formal agreement, like I said, and they'll have to agree to this, and then they sign, and an executive member, one of us, will have to receive this form, and then we'll put our name, sign, and date it, and that will be the formal membership agreement. I think it's about two pages long, and I'm still accepting edits or recommendations or anything like that. I'm sure Dr. Gaboni, well, actually, I know Dr. Gaboni still has more suggestions. So, but it'll keep growing. So,
document, will it be part? Will I add this to what I'll be doing?
Yes, ma'am.
Okay.
Yes.
Yes.
What is the best way for people to pay their membership fee?
So ways could be either the Cash App, Venmo, because those are the organization platform that we use, or PayPal, or checks, or cash, if you can find me. And then so on the discussion, we said you have 2 months, so March 1st to April 30th. So you can pay in installment, or you can pay one time, as long as this is covered by the end of the second month that you showed interest. So the goal was you're not going to be called a full member until contribution is completed. So let's say you are at the level of 75, and then you pay maybe 30 or 30 again. You see, it doesn't count until you finish that 15. So then at least you say, okay, now you're a full member, so you can have those benefit members. So they said, yeah, people are saying just in case maybe the first month may be hard, that's why they were given 2 months. So they can have those revenues. So once this is completed in a way that Ms. Valentine's have on the process, then that's the part which we attach to all the forms of payments. And then so when somebody say, okay, I'm interested, they indicate that part, so then we direct her to go to Ms. Valentine, then she goes through her thing and then get them to sign, and they pay that way.
Thank you.
You're welcome. Any other questions? Okay, thank you. I'm gonna cruise back to the next thing here. So now we have the community outreach. So the community outreach, Ms. Janet was here during the leadership meeting on Thursday night, and she shared that she's working on 2 areas that for the community outreach. And thank you very much, Ms. Janet, for your effort. So she's looking at the Palm Beach Children, Boys and Girls Club, and this can be done in each cities, especially here in Florida. And then the idea is like if there's any opportunity for QHSC to go into those clubs and either provide what they need, whether if it's health screening or some resources, supplies or something like that. So she's still working on it to identify exactly what exactly is needed and what the QHSC contribution will be. And another one she's working on is Feed South Florida activity. And this is providing the food that sometimes at the stores, they deem it cannot be sold just because there's mark. And you know, like when you go to the store and start choosing, okay, I like this mango, or this one is scratch, I don't want it. So when the store figuring out, okay, this is not selected because of whatever reason or how it looks like, then they put those things on the side. So the Feed South Florida, they go usually take those things, and then that's where they get the volunteers to come and sort out anything that can be edible, because there are some people who are homeless, don't have food. So then we can go in and then lay a hand to say, okay, we can help sort the food and we can help pack the food so it can be distributed to the homeless shelters and something like that. So they're looking at a group of 6 to 8, which I promised Ms. Janet that to tell them that we definitely be able to get those 8 people if needed. Our plan right now, when we see it, at least we can start once a month, and then put in a schedule. So if we are able to do every second Saturday or every third, whatever she's gonna find what the possibilities are. And then then from there, we're gonna share in the group to get people sign up. So let's say I can't do March, but I can do April, and I can do June, I can do whatever. So those are things that people who are volunteers, this is for everybody who QHSC friends and members want to volunteer, then yes, you can do that. And then so as long as we just pack throughout the year, we know for sure once a month we have opportunity. If we are able, and maybe there's 1 month, there's 16 people, so we can choose another day and just say, okay, add this day, add this day. But at least we want them to be consistent so they know for sure the third week of each month, QHSC is going to bring their 8 people. And that's what we want. And people who are volunteering or sign up, please, once you sign up, don't just walk away unless it's absolutely necessary. Because remember, if they're expecting 8 of us, they're going to expect the work that is done by 8 people. Versus if there's 8 sign up and then 4 show up, that means those 4 will have to stay longer. And what she said, usually the block of time is at least up to 4 hours. So if we can volunteer to make it worthwhile, you driving over there for 4 hours and then leave. And if it's Saturday morning or Saturday afternoon, whatever they're asking, and if we can see it's feasible for us, yes. They do have days on weekdays. And if that's the, maybe one group say, you know what, it would be better for us to have Wednesday night, or like maybe from 5 to 9, I don't know. When they give those options, we share in the group for the QHSC friends and members. So then we figure it out how many people can sign up, which day is feasible for us, and which day they will benefit the Florida, so feed South Florida's will benefit. And then we volunteer. So those are the 2 ones she's working. There's some other things we're working on, but we have not gotten the confirmation yet. So whatever we get, we're going to share. The goal is to definitely increase our exposure here locally, and then of course start going other states if we can. But we have to find it to start here so we can develop a consistency. And then so if everybody here QHSC, then they know, oh, QHSC help us, feed the homeless. Or QHSC work with the boys and girls. As I said, we have people of different disciplines. It might not be on a healthcare only. It might be sports. It might be teaching them how to cook something or eat healthy. So we do have expertise in all these areas. So as soon as we learn those opportunities, and if you can, even if you volunteer once every quarter, that's okay. We'll take that opportunity so we can go and help our own communities. Any other questions? Any questions for the community outreach activities? No? And people who are out of state, for example, they might say, oh, how am I going to help if I don't even live in the same state? So some of the things, let's say for the boys and girls, we are supposed to buy supplies of, I don't know, something. So you can help us do fundraising. You can do things even online, virtual, or whatever to participate. If let's say maybe they want to do some education and we can do virtual, you can participate from anywhere in the country or even outside the country. So those are things that even if we are not there physically, but you can still help us wherever you are. But as I said, we're going to share that opportunity and people can join in. All I'm asking you guys is just your participation and volunteer. Even if you plan every 2-3 months, you volunteer once, we appreciate that time, because that time is going to be saved from somebody else to do another time.
I actually do have a question.
Yes, ma'am.
Volunteering for Feeding South Florida. So I know I remember the last time I checked, they said that children can also volunteer, but there's like a certain age they would have. So well, first of all, I wanted to know, would you be okay with the idea of having like older kids also volunteer with us to add to that head count? And then if you are okay with it, maybe we can ask Janet to confirm with someone from Feeding South Florida with the age limit so that we know.
Exactly. So that's the part which, we spoke on the side, but yes, so she's going to be able to check on it and see if there's any restrictions. Yeah, because sometimes if something is heavy, they don't want the younger people to be there and get hurt. So the goal is that if they're older enough to, let's say there's sorting out, I don't know, papers or something, or, like a package where they're sitting down. So 10-year-old can do that. But if it's something you help lifting those crates and stuff, you don't want those younger people because they're going to hurt themselves. So I agree with you. We're going to ask Janet to help. yes, that person may add into the account. Let's say that time we have only 4 people, and then some people have teenagers. We're gonna welcome their help, as long as if there's anything that they can do and help, definitely we do that.
Okay, awesome.
Yes, those will be our young QHSC, upcoming QHSC.
Yep.
Okay, thank you. That was an excellent question, Valentine. Thank you. Okay. Okay, so we are going to the Qhsc shop. Miss Bree here. Thank you very much. You want to give them the little background before I start sharing the website, Bree?
Sure. Okay, so it's pretty simple. We started the Etsy shop because Amazon declined us, but so you just go to Etsy.com and you should be able to type in QHSC in the search bar and it will bring you to all the products in Dr. Gabon's gift shop, or you can go there by just clicking on the link and it will bring you straight there. And every product you buy does make a contribution to QHSC.
So those are some of the items. And if you have any suggestion that maybe you think pajamas will look nice with the QHSC, yes, we have our own, very own designer here.
Yeah.
Okay. Thanks for letting me know. But yeah, so when you see those items, as I said, then you say, okay, maybe we want pajamas. That may look nice with the logo, QHSC logo. So just let Bree know. Remember that website, the email I told you, info that Dr. Gaboni QHSC. If you send that information in there, then if it's available where Bree is designing these things, then it should be available for sale. So there's different parts, different design. It's unlimited. So when you are buying this thing, yes, you get this item for yourself, but the contribution that you do with each item is coming to the QHSC and help us function better, use that funds to support some of the everyday function, like paying those for the website or the social media access, so we're able to do those things when we're hosting meetings and all stuff like that. So it looks beautiful. And then good news from that, we had yesterday our first selling item. So thank you. And that person opened the door so anybody can buy, and you can buy as many things as you can. The more you buy, the more we get that contribution for every item you're buying. So, and we say thank you in advance, and let's show them what the QHSC is. And everybody should show up someday. They're wearing the whole country.
Is this the merchandise that we will be wearing for the mission?
So, for example, the T-shirt, yes, you'll be just probably one of the T-shirts will be, yeah, like that one, for example, the black one, yes. When we get to the mission, the medical mission, sorry, definitely one black is going to be one of them, and then the organization is going to give another T-shirt and one scrub or one polo. So we usually give more than that, but for financially we can't keep doing that part. But now we're getting to somewhere like, okay, at least we share costs, and then so that part, when you're giving those 2 items from the organization, so you can add your stuff by buying yourself from the yes.
Okay. Perfect.
Yeah.
Thank you.
Yes. So it's gonna be the same, the same logo, the same thing. So then when you buy, you can still wear them over there too. Yes.
Add, like before you guys buy the t-shirts though, make sure you look at all the photos because some of them don't have the back. So I don't want people to think they're buying a t-shirt with the front and the back when some of them don't have the back.
Okay.
Yeah, because she's designing according to what the already placement of the T-shirt or the item that allows you. So you can put the logo or you can put the text. So some of them just allow 1 item versus 2, and some of them allows more than 1. So you can see that part. But yeah, so she's right. Go to the details when you click on it. Let me see if it's gonna. Okay, so you see that one has front and back.
Haba na haba.
Yes.
Yeah, I honestly think you did such a fantastic job with this website. I think it looks fantastic, and I really appreciate the merch situation. I think it's fantastic.
Yeah, she did an excellent job. Okay, so the code of conduct now. So this is the part that yes, once we recruit the people to come to the medical mission, then they need to know what is the expectation. This is specifically for medical mission. And we thank Dr. Gwen Randall for drafting and work on it. And then for the executive team went through and just review and add whatever we needed to add and make it as clear as we can. So this is what we, when the volunteers sign up and they want to go to the medical mission before they can even do like a first payment, once they speak with Ms. Valentine and make sure they are ready to commit, this is the part that they need to do. So it's a code of conduct for the somebody who is going to be a missioner. In consideration of the opportunity to participate in this mission journey as a volunteer, and in consideration of the obligations incurred by QHSC mission leaders, I agree and accept the following. Number one, I fully understand this is not a vacation opportunity, but it is an opportunity to save our brothers and sisters afar to help address some of their disparities in healthcare. I fully understand that I will represent not only myself, but also my fellow team members and the organization. I understand that I'm in Tanzania to serve and not be served. I fully understand that it is my responsibility to follow the guidelines and expectations of the team leaders while respecting the host country and facilities. I agree to cooperate with the team leader concerning our work and life together, including daily assignments, food, lodging, and transport, and to stay with the team for the duration of the journey. I will follow the rules, guidelines given at the Luther House upon arrival. I understand there are rules in place for my safety and others that I may not understand, but agree to follow. All activities will include the group as a whole and as budgeted. I am responsible for the amount of dollars to cover Tanzanian expenses. And please indicating, so then they either said yes and no. And then so the trip pricing agreement, these people just to be aware of, I have read an information page regarding the cost of the trip. So that's by the time we'll be sharing that budget estimates so people know how much it's gonna cost, where it's gonna go and what items are covered. I'm responsible for the full payment of my trip to qhsc.org. I understand that if I fail to pay in full by the departure date, I will not be allowed to travel with the team. I understand that the 250 deposit is non-refundable if for any reason I cancel or reschedule my trip. I understand that it is and is not covered by my payment to qhsc.org. I understand that refund due to the cancellation by myself or QHSC for any reason before the trip is subject to circumstances. So I'll give a little background and then let people discuss that. So the reason that we have this agreement is the previous medical mission, we have issues. Some people went there and thought that they should not be working those long hours or how many activities, and they wanted to take time off or not doing whatever they're supposed to do. And then so that put pressure for the people who show up to go to work, because now the workload increases for those who show up and while other people are resting behind. And then so the idea is to make as clear as you can before you sign up, before you put your money down, because once you put your money down, a lot of negotiations are done in groups. So if I have 47 people and I'm reserving the shuttle or hotels or food, or I pay those things ahead of time because you have to hold those spot. So when I pay for 47 and then only 30 people show up, I don't get a discount. It's gone because you already paid for it. So then that leaves the pressure to the organization to complete the payment because half of you don't want to do it. So that's the idea, is like we have to spell from the beginning that these things is not an individual. So if I decided not to go, you're going to refund me as in, no, it doesn't work that way. And that's why we have to do all those things ahead of time. Like we wanted to see if the payment should be done probably before even the August, so we can get to pay for the allocation. The price for meals, for example, last time when we went, I believe it was like $20 per person. But because it's the group, they will sometimes lower it until $15. So, but if I'm paying for 40 people and then only 30 people show up, and then those 10 people go and eat different places and expect the organization to pay because they've already paid, I did not negotiate to the different location. So that means if I pay that, that means I'm paying out of the pocket, not the organization, because the organization doesn't have the money extras to cover those costs. And that's why, hence, we have now We have to have some money to cover those changes and to cover the uncertainty, because you cannot guarantee, I cannot guarantee that everything is going to go smooth. We pray for it, but we don't get that chance to go to do everything we want the same way we want. So that's why if we need to get an emergency bus to go and take the group maybe from one place to another, those are the ones that I agree the organization can cover the cost. But it's not that the organization has the money, and that's why we have those emergencies or miscellaneous coverage, because we know things can happen. For example, if a volunteer gets sick, I don't expect you to start paying extra for the transportation from either the hospital or school to go back to the hotel for you to rest. I don't expect you to do that. The organization is going to make an effort to make sure you get there. That's something that we can't put on the individual volunteer. However, if you get to the site and then you said, oh, I'm tired, I need to go, that has nothing to do with the organization. That's your interest. If you are going to pay extra, then you should be prepared to pay extra. And that one, the problem is because it's not organized, or those transportation are not safely secured, you might get in trouble because you went outside the organized or agreement to those transportation part. The same thing, people wanted to go to the city by themselves. I mean, people are very creative, I understand. People have money, I don't dispute that. But if you go somewhere else you've never been, you don't speak the language, even if you learn from the Duolingo, great. But that's not going to make sure you are safe. Because when you go there, they know you are not a Tanzanian. Because for the way you speak, where you carry yourself, the way you're going to be asking questions, they know you're not Tanzanian. So chances is your safety is already a target right then and there, because they know who are you going to call. There's no 911 there. So those are the things that I want to make sure if you agree to go to the mission, you are safe and we'll bring you back safely. If you want to do something extra, then it has to be agreed from the beginning. Okay, I'm coming later, maybe because I have a conference, I'm coming in the middle. That's okay. Once we agree from that part, we know for sure we're going to be responsible as soon as you land into Tanzania, not before that. And then because that time I can't control that. And then, oh, I'm staying longer after the medical mission. If that's what the day the medical mission is over, you have already released the organization from that part. You can stay there. I can't force you to stay with me or come back with me. But as long as you know that the hands of Qhsc ends to that day when it was allotted, September 10 to September 23, and that's it. You stay to 25/6, you love the country, good for you. But then you're on your own. And those are things that we just want to make sure people are aware. I don't want people to go blindly and say, oh, I can do it. I travel the whole country or the whole world. That's fine. That's great. But just know that if you get in trouble, you're going to be in trouble, because I don't know. But if the organization arrange the transportation to go to the shopping center or to dinner or something, is we know that person who's taking you. If something happens, I know who to hold them accountable, to say, I gave you 10 or 15 people to take to them this place. So you have to wait until they're done, bring them back. But if you go and take your own car, it's maybe a family in Tanzania, great. But what happens if that person disappears? I don't know who they are. So, and I said, the people in Tanzania, they are very friendly, very, very friendly. And they would want to show you the world. But the problem is as soon as you do that, there's no safety net. And that's why the rules might be very dry and cut, is because we want to make sure you get the picture. We love to have fun. We do encourage to include it at the safari all time to rest. We try to find some entertainment. Yes, that within organize with the group, but don't do it by yourself. Any questions?
Yeah,
the last thing is just, what are we going to do? The medical mission is scheduled for September 10 to 23rd. Those are exactly 2 weeks. Also, usually I put the 10th there. Remember, there's a Saturday there. So if we fly away either Friday night or whatever, sometimes you get the tickets that are cheaper that way. If we fly Friday night and then you get there Sunday. So our goal is to make sure we use that Monday to work. But like that's in medical mission, Monday, that's when we were arriving. So there was so many things there, and it makes the schedule a little bit tight. But if we can try, when we started putting the numbers and finding the tickets, then we'll be better understand what exactly days we can go there or arriving at the in Tanzania. And we're going to try at least the day that we arrive. We don't put too many things in there, but still, I believe to meet those executive people there and just for understanding each other. At least we had the chance, at least we know those hospitals. So now if we're working with the same hospital again, hopefully maybe it might not take that much. And then hopefully the arriving process at the airport, maybe we can cut it down to make sure we post all the things that we need to send it to Tanzania before we go the day of, and avoid all those extra baggage. So when we're clearing to get inside the country, we arrive there at 6 or we were 8, and maybe we're in bed until 2. So at least we have some time to rest, because I think even not resting or changing the hotels, that skew our resting time. And then I think stress started from this day one, and it was hard for people to recover and join the team again. So we're going to try to have at least plan A and B, like what Catherine was saying. Some of the things I can't predict, but we try to have some safety net around those areas, and make sure if we know there's any issues, then they need to find out, and we're going to make it as clear as we can. If they find out there's an issue, then we were in air, they need to find a solution like immediately before we get there, and they should be able to have the options without us start thinking and right like that. So we're going to continue working with that part. As I said, we learn and we improve. So the schedule now. So what are we going to do in this medical mission? Similar to last time. So by the end of this month, we're going to finish that part, because I'm going to start talking to individual people who are the lead of different projects and put their name there. And if they have people already in that section, then we're just going to fill it up. By the time we start recruiting people, which is March 1st, we're going to have these areas almost filled out as much as we can. So then we say, I'm going to take an example for Dr. Msambichaka. So let's say she's going to be up under column E, so neonatal resuscitation or help baby breathe. So we're going to say which hospitals by then we already decided to go. Okay, we're going to go to Mwananyamala, Buguruni, maybe in Mloganzila. Okay, so then group leader, that's her name. And then who is she going to be working with to be the second person leader? Last time we have Dr. Ngido. If he's going again, then he might be there too. Or she might have different ideas. So that's fine. We know the leading people. Timeline, how long are we going to go to those hospitals? So then she will know, okay, maybe Monday, Tuesday is this hospital, Wednesday, Thursday. So at least we give the leaders on each project to identify where they're going to go and how many people they need for that area. So that also will help us to make sure each group is solid and what they need to do. And then if there's any need from the organization, help with scheduling or like transportation. So then at least we know, okay, the Help Baby Breathe group are 7, 8, or 10 people. They will be going here and here and here. We should get the shuttle from that time. And then so we know that is going to cost this. And then probably at the end, so then, okay, what you are doing, we're trying to accommodate every individual volunteer. This is how much they can pay to try and supplement that, the expenses. And then so if we know for sure the number of volunteers, maybe she says she needs 8, there's only 2 people. So then we are looking for 6 more or something like that. So then we add that part. The same thing, somebody who is leading the backpack and school supply. This is Mrs. Janet Musa. She was already focused on that part. So the same thing, timeline. So when are we going to the school and doing the backpack? So are we doing 2 weeks of backpack or just 1 week? Or no, if it's 1 week, how many days are we going to do? So all those things right now is going to be spelled out before we start recruiting. So if she say, I think when we're doing the backpack, we're going to do maybe the hand washing, dental hygiene, the same time. So I need 8 people, whatever. And then so if that's the 8 people, when you're recruiting, people say, oh, I want to go to school. Okay, then you're going to go to the school that are helping with this school supplies and hand washing. And then so then they itemize that way. So maybe you're doing the second week only for the backpack and hand washing and stuff. Okay, fine. If nutrition, they're there, okay, they're going to do the first week. So we itemize that from the beginning. So the first week, people who are doing school backpack, and then the another first week for the nutrition. Are we sharing the same people? Or are we just going to separate those 2 things? So if we know from the beginning, like last time, Mrs. Christine Behuniak and Ms. Teresa Cooper, they did the nutrition by themselves. The whole time they knew the first week they're going to do the classes. The second week was just talking to the teachers and worry about the saving the kitchen. So those are the things that we want to make sure we know ahead of time. Similar things for vision. Dr. Stenville, she's already into far away ahead of a lot of us here. She's already knowing that she's going to deal with adults. She just responded to me yesterday. She's going to deal with adult and she wants to work with adult. That means, because from the previous activities, we realized 47% of the adults needed glasses and they've never had visual acuity done. So yes, Are we going to do in one area for the adults? Are we going to go to the community? More like it's going to be in the community, because if you're looking for adults, it has to be in the community, open community. Where? And then are we going to do the parents of the kids that we went to the hospital, after to the school? If it's the parents, then we need to give them specific dates so the parents can line up, and then those days can be here. How long are they going to, how many of them, how long is it going to take for the day? So we need to know that Monday, Tuesday is going to be in open community, and then Thursday, Friday, maybe it's going to be the parents of the students, and then the follow up for the student. So then the schedule is going to be like that, and how many people she needs, and then it's going to be structured out. We're not trying to extend the volunteers. So work vision, work hand washing, work in resuscitation, no. Everybody's going to go to those specific areas. So if your activity is done on the first week, the second week you can be assigned to go and help another group. But there's no like the first week you mix 2-3 things. That'll be too much, and that's why people get stretched out or burned out easy. So there's so many programs you can see: vision, hand washing, backpack, resuscitation, thermal regression, anesthesia that Dr. Gwen Randall, and then ER and emergencies also goes with postpartum hemorrhage and OB. So those 2 things, and then there's a band also. Nutrition, I didn't put it here because we're still talking to Miss Christine, and I know she's going to do nutrition no matter what, but I just need to see how she's thinking of doing it this year, and then we're going to add it there. And then usually that goes with feeding the children. So to try and find ways to get more money and hopefully give them lunch again for 2 weeks. Or if the idea is to give them breakfast for 2 weeks, then that's still plan. If we have more money, yeah, we feed them for a whole year. But that's just still the works is going to continue doing the work. So that's the part of it. And then we have, whoops, sorry. When I was start telling you like a few minutes ago, like schedule, we need to know exactly. So this is the second schedule. So once we finish that part to identify the leaders of each group, then we're gonna come and say now vision screening, more like Monday. I put this just to traveling, going here, wherever, who's gonna be where, what. But then it's gonna start Monday, the 11th. Okay, so vision screening, where are they gonna be? Community outreach in whatever the city is. Resuscitation, where are they gonna be? Group, maybe Mwananyamala or Buguruni or something, I don't know. Thermal regression, where are they going to be? So we have that schedule, then you know for sure, my group is thermal regression, I need to be to Mwananyamala group. Okay, guys, Mwananyamala is leaving at 6 o'clock because they have to do fine to get to the rounds in the morning. So then you have to know when you're waking up, and people, team leads that from the previous screen, team leader is going to lead their own group to say, okay, guys, tomorrow we are leaving at this time, we're doing this and this and this and this. So if we give that way, people will know for sure, then they don't have to hear so many different groups and get confused. As long as you know, you guys are going to travel at 6 o'clock, this group is going to go at 7 o'clock, maybe because the school does not open before that, or whatever the reason is. So we have specific time. The leader of each project are going to take charge, and then they know. So then usually at the end of the day, we're going to cover, or the leading team members are going to discuss and see what went well, what did not well, and then maybe the next day we should revise for something else, or combine these 2 trips then to save time or something like that. But the idea is we're going to try to get more shuttle than one to make sure it's accommodated, and that's why we need to know the numbers of people that will be in each group. And when you are recruiting, let's say Dr. Msambichaka is very lucky, she has 20 people wants to go that part. So, okay, are they going to go all of them in one hospital, or we're going to split them and put it in 2 hospitals? So if it's 2 hospitals, is Dr. Msambichaka is going to take one group, and then Dr. Nkido is going, or somebody else is identified, is going to split them. So when we do that, even if we're in the same group, different times of going, we need to be able to figure that part out. And that's why we have to know first how many people are going in each group. Okay, any questions? So just to give them also the background, there's so many things that we are doing. Yes, just by looking at it, people be like, oh my God, there's so much stuff. But no, see it as a project. You sign up for one project, that's okay. Unless the project is shorter, like say maybe the first 3 days and then the program is over. Then yes, the 4th day you can be scheduled. So just worry about that one day, one project. Don't worry about too many things at once. It shows, yes, there's so many of them, but we have to put them in one screen to be able to identify the logistics, like who is going to eat breakfast, who is going to go to which transport or shuttle or something, what they need. Because remember, when we say which group goes by itself, where are they going to eat? When are they coming back? Are they coming to eat with us dinner, or are they going to be late? Or is the hospital volunteers to give them dinner? Okay, so that money can go to something else, help them get more water. We're still going to provide water for everybody else. Like last time, we're going to make a little bit better this time. Either we buy actual bottles of water and everybody leaves with it from the morning, because at least you have to drink. Because sometimes when you start buying them, we're buying at 10 or 11. Some people want to drink at 9. And then so they struggle because they have to wait until the organization buy the water. So another option, I was talking to another gentleman saying, I wanted them to come and buy the water and deliver them at Luther House. So we have those bottles, and then you can keep it in the morning, just take it with you and go. And then during lunchtime, you get the one which is cooler because they put some your ice on it. But at least if you need to wet your mouth or drink something, you have it with you. So everybody's going to be getting like a bottle of water in the morning, go with it, versus waiting until 11. Because we didn't have the water with us at the hostel. So, I mean, those are things that, I mean, we are adding, and people who have gone to the medical mission before, please give us ideas that we think it will make it a little bit easier to whatever. Still sorting of the stuff is going to be still the same way. So the first day is going to be sorting out. And we hope that when we are packing stuff here now, we can sort them in a way that, okay, this box is going to be going to Mananyamala group. This box is going to go to Muhimbili groups. Because if we get the chance to do them now, it's going to be easier than doing when we are there, because it's a lot of work. I know little people help with packing the backpack and stuff at night in darkness. I appreciate, but if we had those things ahead of time, we could have done those things ahead of time. And now when we start recruiting March 1st, we're going to start collecting things specifically for those areas. So, and we encourage people to give us at least by March. So at least 2 months, March and April, we have to go aggressively to get those items. So by March, this end of March, we have them. And then if I can get those things and then we ship them, or we send it to Mr. Branca there. And then because usually the person who help us ship, he's that way. So it will be easier to ship them that way and send it to Tanzania. Unless we get another person who can ship stuff for them, maybe for cheaper prices, or and ensure that we get them to the Luther House, not worried about the port of entry. So that would be the best thing. So when we're coming in, we're not stressed out with carrying all these bags and worried about the pencils and whatever. So we're trying to get those things a little bit more efficient and get those things as fast as we can. Okay, so let's do the open questions round, and any comments, things that you hope we're going to accomplish this year, things that you think we should add or we are missing.
I think we're off to a good start. So I honestly can't think of anything right now. I feel like we've covered, we have all of our bases covered. I mean, that all the bases that we know of, at least. So yeah, we're off to a good start. And I think as time comes along, depending on whatever situation that's presented, I'm pretty sure that will help us to think of more things, have more ideas and suggestions to share.
Great, thank you. Miss Bree, Catherine, Lady V, anybody?
No, Yessie was saying that it's going to be good to do the rooftop, because she felt that we really took over their kitchen, their cafeteria on the bottom. So even if it's just dinner to do on the rooftop, she was happy about that.
No, I agree. That also is going to give us more time to be close together, the way it's set up there, and then we can chit-chatting and catch up for the day and try to relax and nice breeze, because it's a beautiful view out there.
Yes.
Mm-hmm. Yes. So I think, as I said, they are happy to do that. And I think they've never had a huge group stay there for 2 weeks. Mm-hmm. So it was good for income for them. But I said, no, we're going to share that income. You have to give us more discount. But yeah, yes. So they're happy with that.
Yessie will be downstairs making coffee, but
I said, no, she's going to make more than coffee. She's going to show them. We're going to be giving orders when we're working. We just give orders, and then yes, you'll be in the kitchen cooking.
Okay, sounds good.
No, thank you. Any other things? Miss Catherine, Lady V?
I am.
I don't have anything, but sorry. But I will talk to you later about an idea I do have.
Okay. Sounds good. Miss Catherine?
I'm not good.
Okay. Oh, I want to share what Dr. Msambicheka said in the group. So when we do all these things, and sometimes it's kind of, as a volunteer, maybe if you don't hear it enough, it feels like we're doing so much and nobody's appreciating it. And I mean, I hear some of the comments, and then whenever I get, if somebody put it in writing, then I put it in, I usually cut and paste and then put it in a group, at least you see it. But Dr. Msambicheka went to Tanzania, I think we had on a month or 2 months ago, and she went to one of the hospital, Mwananyamala hospital there. We did all the training there, help baby postpartum hemorrhage and stuff. And of course, some of the nurses and the doctors were sent to Muhimbili to get that training for the first week. So in her visit, they were saying that they were so happy. I'm going to read the way she wrote it. So in response to some of the questions asked in the meeting, I did stop at Mwananyamala for a few hours last month. The nurses appreciated the postpartum hemorrhage knowledge from the training. They told her that they believe they were able to save a woman's life for a couple of weeks before my visit because of the lesson they learned from the training. So you can see that heartwarming my heart. I'm gonna probably cry now. But anyway, and then she said, yeah, so kudos to all to all. And then they were asking when they will get the NSG. Remember those NSG, the real gametes we are using? We were not able to afford that because we raised the money for 10 of them to buy them. But the shipping was almost twice the amount of the money we raised to buy the actual item, and we couldn't do it. And we were trying to find ways how the government can probably pay or find another way to do it, but we've not been successful yet. We still work behind the scene. So eventually someday if we are able to, then we'll be able to buy those things. Or if we find another vendor who doesn't have $1,500 shipment, I just don't understand. And then if we find somebody who does not ask for that much, then yes, we should be able to buy and at least give them. But the problem is the basic number of the NSG is needed for each hospital, counting the number of the postpartum hemorrhage events. At least they need 4. Definitely they need 2, because if one is being used, one can be for the next person. Labor and delivery, it always happens crazy. But then the problem is we having 2, and then they go to Muhimbili, where the central plus everybody goes there who's acute. Then Muhimbili have to have 4 or 5 of them, because if somebody comes in, it's going to be bloody, dirty. So they have to clean that one and give the hospital a clean one. So the problem with that is Muhimbili they were having is, yes, even if you give us 6 or 10, what happens is the hospital a different hospital that is not in that 4 group send a patient who require the NSG. What are we going to do about it? I can't tell them that don't use it. I can't. But then if they do that, that means they will never have anything going on. So it's a challenge, but we're going to work and continue working with that part. I mean, those are as I said, when we get these messages, that's how it pushes me to try and do as much as I can, because my goal is just to save one mom, one baby, one gentleman, for whatever we are doing, just to save one life, because otherwise it could have been lost. So if we do that, and there's, 40 of us, that means 40 lives spared. I mean, that, I don't even know what to say. But I mean, it's those good news, yes, they might not tell us in our face, but they could, behind the scene, they take it wherever we are teaching them. And that's why we really value people who wants to go, and we want to give them the best experience so they can go and share that part. We had that story for Lady V when she did take care of the child who was born in the middle of nowhere. That child would have never been taken care of by anybody if we didn't pass through there. Probably they could have had an infection or, God forbid, die from it. But we just stopped there, and Lady V took over and do that. So those things that fuel us to be able to say, we need to do better, we need to do stuff, we need to collect more stuff with whatever they need and help as much as we can. Even if we don't see the response right now, but at least just knowing that something can happen like that, saving in one life, is worth doing, is worth the headache. So we're going to keep doing it as much as we can. And thank you, Dr. Msambichaka, for sharing that, but because it just helps us to know our work is not, it's noticeable. And that's why I said right now, I didn't want to share the whole thing in the meeting, but there's so many programs that they want to work with us because they see what we're doing. And then so once everything is legit, we sign the papers, then we're going to start making it public to share what exactly it is. So there's good news. A lot of things are coming in. So whatever you guys were doing, whatever the time you spare with the organization, it is highly, highly appreciated. And thank you for your time, because you have no idea. A lot of people appreciate that part. Mr. Jones?
Yes, the meeting was very productive, and
yes,
it was very informational and informative, and we thank God for that.
Okay.
Now, Lord, in the name of Jesus Christ, as we come before you today, oh God, we just want to give thanks and great for your greatness, for your glory, oh God, for your enduring works. We thank you, God, for laying a hand upon QHSC and its members and its volunteers and its mission, oh God, and the global impact that it's having in our parts of the world. We ask you now, God, to bind each and every one of us together as a close-knit family, oh God. Let your word be multiplied, oh God. We ask you, oh God, to be in the midst of this vision, this mission, this training, oh God. Be in the midst of this excellent work in healthcare and education, oh God. Provide the volunteers, the true volunteers, the one who has a heart for mission, oh God, that this may go well with us this particular year. Even our airline tickets, the place that we're staying, the food that we're eating, the people that we're serving, oh God, and even everybody that we're making friends with, oh God. We ask you right now to touch them in a special way, oh God, their minds, their hearts, their souls, oh God, and even their infirmities, oh God, whatever they may have need of right now, and you provide it, oh God, because they are providing for your people in a special way, oh God. You said, he that giveth to the poor liveth to the Lord, and the Lord shall repay. God, we live in our time, our service, our finances, oh God, to help your people, oh God. Now repay us, oh God, according to your word. This we ask in the name of Jesus Christ, our Lord and our Savior. Amen and amen.
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 Thank you. Thank you. Be blessed. Thank you.
Welcome.
Thank you, everyone. Have a great day. I'm out.
Thank you. Thank you, guys.
Thank
Have
you.
a wonderful day.
Thank you. You too, yeah. Bye, guys.
Bye.
Bye.